Thank you very much for the invitation from the very international and elegant ESCO board. My lecture today is about the ostomy workshop, what a gastroenterologist should know. The word ostomy from the dictionary is coming from the modern Latin stoma, which means opening or orifice, or from the Greek stoma, which means the mouth. So ostomy is an opening in the small or large bowel that is created as an outlet through the anterior abdominal wall in order to pass fecal matter into a specific bag. And the stoma is the part of the intestine or the bowel that we use to create this outlet. What is the purpose of this stoma? As we said, to get rid of the feces by systematic defecation. It can reduce pain and discomfort and may help to relieve symptoms of intestinal disease. What are the conditions that we might need to use a stoma? We have so many conditions like inflammatory bowel disease, diverticular disease, polyps, cancers, disorders of the bowel functions like Hirschsprung, obstruction, stricture, fistulae, accidental or penetrating injury, congenital forms, fecal incontinence, or necrotizing enterocolitis. What about the condition that we might need to do a total procto-colectomy and we will need a permanent use of such stoma? Maybe the familial adenomatous polyposis when the size is more than 1 centimeter, when they are more than 100, when they are suspicious like being villous or tubulovillous. Some conditions like ulcerative colitis not responding to medication, having dysplasia, or having patients. What are the types of ostomy? According to the site, maybe colostomy, which is an artificial opening made to the large bowel, or from the small bowel, which is called Iliostomy. Here are the sites of stomas, different sites. We can see on the left side the iliostomy and the right side the different kinds of colostomies we can see from the ascending, transverse, descending, or sigmoid colostomies. According to the permanency of this stoma, it could be permanent where the section of the part of the colon is removed and we can no longer use the anus as an exit. It can be sometimes temporary and we just need to rest a part of this bowel, and at that time we will use a temporary ostomy. What are the sites we can use to choose to put the stoma in? Of course, we need a flat area of the skin. Patient can see it. We should avoid creases, scars, umbilicus, prominences, and the belt line, so not to compress it. And the site should be identified in all patient conditions, lying, sitting, or standing. For that, we can see that iliostomies usually are in the right iliac fossa, sigmoid in the left, and the transverse might be in the right or left upper quadrants. What are the effects following iliostomy? Of course, we will lose the colonic, with colonic diversion, we will lose the absorptive function of the colon, so we will lose lots of fluids as well as some electrolytes. Consequently, the state of oliguria will happen and the change of the urinary sodium and potassium will change. This will allow the patient to form more urolithiasis and lose some vitamins. Of course, the condition of ostomy is an interrelay between the healthcare provider and the ostomy patient, and it needs a lot of will and perseverance. What are the routine care of ostomies? Pouch replacement. There are two kinds of pouch. The closed one, and this should be removed and replaced, or the open end, and this can be emptied and replaced after 1 week or so. Of course, we should empty the pouch after being 1/3 full, otherwise it will fall down because of weight, and we can change the pouch every 1 to 2 weeks or whenever mandatory. Or of course, for foul odor of the ostomy, we should use some things like chlorine or bismuth or chlorophyllene complex. How to attach the stoma appliance? We need to know that there is something called the wafer or the skin barrier, and this is its shape. We need a clip, and we need the drainage pouch or the bag. Of course, we have so many companies help in that and provide the patient with so many appliances so that he can lead a normal life. And this is the advertisement, never miss a moment. And here you can see that the ostomy patient is playing music and she looks so pretty. Step 1 is to remove the colostomy bag carefully. Then we should clean it with warm water and soap, let it dry. Try using skin barrier such as stoma powder or some gel. And we can see here there is advertisement for a tape that allows you water seal to go and swim. And we can see here the many things that use in advertisement as gel or as tablets to take to lose the gases and to lose the odor of the feces. Step 4 is to place the transparent stoma template over the stoma to assess the diameter. Then choose the appropriate diameter from the skin barrier part or the skin wafer. We can see here also other companies with different kinds of bags. And we can see also that there is a sort of support, technical support to patients with bags. Then we remove the sticker of the wafer and fix it carefully, and then fix the pouch into the wafer and clip the end and apply the micro plasters. We can see also that there are some applications now to help the patient, and of course the medical care either by nurses or special dietitians or special doctors for the care of the stoma and the care of the ostomy. Well, of course, it comes with complications like early complications, ischemia, bleeding, retraction, or late complication like prolapse or hernia. Ischemia, of course, when there is impairment of blood flow where the stoma is bag is tight or the dress is tight. Of course, the management is close monitoring. If there are color changes, we should contact the doctor because there might be turning into gangrene. Always apply a clear plastic appliance so that the patient can see it and avoid tight clothing. What about bleeding? Usually bleeding comes when the patient is over enthusiastic about cleaning, when using template for the measurement, and sometimes the bleeding from the lumen, which is more serious, can happen when there is some recurrence of the pathology like malignancy or when a patient having a portal hypertension in cirrhosis. Management in most of cases should be conservative, sometimes needs compression by a gauge, and usually resolved without interventions. What about retraction? Retraction is when the stoma is retracted into the abdominal cavity. Recession of the stoma always happens when it is away from the skin surface and due to excess tension of the stoma, insufficient fixation, or when the patient gains weight post-operatively and gains weight and becomes a little bit obese. Management, usually we use appliances with rigid flange and apply stoma adhesive paste before fixing the appliance. This will prevent the stoma from being retracted. What about skin excoriation? Of course, we must make sure that the wafer and the pouch are well fixed. We control the excess mucus discharge, be cautious with the site of the stoma and the wafer, and use warm water, mild soap. Never use alcohol agents like Savlon, creams, and powder, and chemical agents because they are very irritant and they will cause skin inflammation and skin excoriation. And never use artificial drying methods like some patients who use the hair dryer to dry it so fast. This is very dangerous. Let it dry with the natural and normal ways without injuring the skin or injuring your stoma. Here we can see conditions where there is excoriation of the skin, and management should be by patient education, considering using 2 pieces of appliances to allow healing. Use the adhesive powder on paste and emollients for the skin care. Of course, there is a very big section for skin care of stoma and needs a lot of interface and interrelay between the patient and the medical service. Herniation, like this condition, or prolapse, like this condition, of course, it will need to be revisited by the surgeon, so it might need some help. What about the colostomy food? Of course, water is very crucial. At least 6 to 7 cups per day is a must. Fibers should be from good amounts of fruits and vegetables. Do not intake lots of cereals and grams as they contain lots of fiber. It will make the stool very bulky and may be very difficult to exit the stoma. Avoid liberal intake of foods like eggs, beans, fish, and alcohol because they are make odor and make gas, and they will be embarrassing for the patient. Same condition in iliostomy, but of course we need to avoid the high fiber food even more than the colostomy because the iliostomy is even narrower than the colostomy. Of course, the use of lots of water is mandatory as well. Then we slowly increase the consumption of foods like cereals, mushrooms, beans, nuts, and so on. And always remember that different people react differently to different kinds of foods. So there is no one single catalog for everyone. And always consult your doctor whenever you notice any changes or irregularities in your daily life or diet. These are examples of low fiber diets that the patients can consume. Of course, the help of a specific and specialized dietitian in colostomies and iliostomies is sometimes mandatory. Of course, we can see also there are some electronic books that can help the patient to how to live with his ostomy. And we can see that it is many chapters: ostomy care, ostomy skin care, diet, nutrition, exercise and fitness, intimacy and love issues with ostomy, and even traveling and playing and practicing sports with ostomy. They are all contained, and they are as ebooks or even print out pamphlets for the patient. We have so many companies integrated in such a thing to help the patient, and even online help and online support with online applications to be the patient that can consult and be helped with. Of course, the story of colostomy and iliostomy might seem to be a little bit difficult in the beginning. The patient, when he sees it for the first time, he thinks it's very easy, but when he starts to do it, he will face lots of difficulties, and he will think that it's very, very, very difficult and very impossible to live with the colostomy. Here I remind you again with the photo from the Paralympics about the swimmer without the arms and his coach who is helping him. It comes with experience, it comes with trial, it comes with perseverance, and it comes with people who have integrate personality. After a while, both of them, the doctor and the patient and even the family, will gain the enough experience to know that it is difficult, but they can manage it and they can lead almost normal life. My take-home messages: ostomy may be a temporary or permanent option that your patient and his family must deal with. It needs good training and patient education to deal with his ostomy. Many companies, smartphone applications, training centers, educating nurses, dietitians, integrating programs are all there in the field to help and to facilitate taking care of this ostomy. It is, of course, very liable to complications and must be monitored cautiously to deal with every and each complication properly. And of course, this is my YouTube channel, Mohamed-Naguib Wifi. You can subscribe it. You can see this lecture and so many other lectures recorded there. You can share it. You can like it. You can subscribe it, and you can use it wherever you want. And thank you very, very, very much.